Hello everyone. Hope you all are doing fine. And I'm here with the next 5 pages of the therapeutic guidelines. Okay, so we will start. The prescription that you need to write today, we will be studying like how to write down a prescription and what would be a valid prescription. A prescription is a legal document. It is a written communication tool between a prescriber and a pharmacist for preparing and dispensing a drug for a patient who may write prescriptions and how they should be written are outlined in the appropriate state and territory legislation. To reduce the potential for error, the prescriber must provide a prescription that is legible, clear, and unambiguous. Although computer generated prescriptions can be easier to read than handwriting prescriptions, errors can still occur. As you all know that this is a saying like that the doctor's prescription writing, it is nobody can understand, only the pharmacist can understand, right? So that's the thing that they have written here, that the computer generated prescriptions are easier to read and they are better than the handwritten, but it's totally fine. Essential information required for a legal prescription written by a dentist varies slightly between the states and territory, but generally comprises what you should be writing on the prescription is you will write prescriber's name, address, telephone number, and qualifications. So this is your information. Okay, then patient's information, which will include his full name, then address, age, date of birth, and for children you should also write the weight, because prescribing any painkiller, we usually weight with the patient's weight or patient's age. Then the date the prescription is written, drug name in full, like preferably the generic or approved name. For example, amoxicillin or benzyl penicillin. These are the generic names. So you should write that name, and drug strength, how much dose the patient needs to take and which form, like the tablets, capsule, or a suspension, what is the form, and quantity of drug to be supplied, drug dose, routes of administration, like what is the route of administration, like oral, IV, IM. Then frequency, how many times does the patient needs to take, like 2 times a day, 3 times a day, and duration, for how many days, like 5 days, 3 days. Clear instructions for the patient, like for example, um, when you're prescribing metronidazole to the patient, you should also write in, you can also write like do not take alcohol with it. You can write the instructions to the patient on the prescription. And any further instructions necessary for the pharmacist, the words for dental treatment, like it is very important that you write down for dental treatment only, because we read in previous pages also that this book only tell us whatever the dentist has to do, and you are only prescribing the drugs to the patient who where there is a dental need, and your signature. Figure 1 is an example of the format, like here it is. So this is your information, then this is patient's information. Then if the medication is PBS based, then you need to tick this box, and then you need to write the full name, its strength, its form, and how many times does he has to take, and for 5 days, or 4 times a day at 6 hourly interval for 5 days. And then below your signature, and you always cross with the line to you always cross the empty space. Okay, and the date should be written, and here the line should be there for dental treatment only. Sorry, excuse me my voice today, because I got cold and cough, so you maybe, yeah. So it's okay. All right. So if the prescription is for an item included in the PBS, the dentist's unique prescriber number must be on the prescription. PBS prescription pads are available. Like When you become a dentist, from the Medicare, they will give you your prescription pad, and there would be a number which is your unique prescriber number. If the prescription is for a non-PBS item, means which is not which medication is not under the pharmaceutical benefit scheme, a PBS prescription form may be used, but all references to the PBS must be crossed out and form endorsed with the word private prescription. For example, here, um, like if the medicine is not PBS based, then you need to then you do not need to take it here. You need to write it is a private prescription. Points to note when writing a prescription include, like, aim to make the prescription tamper proof. Do not, do not cut anything, and try to make it as easier for the pharmacist to read as you can, and use plain English. Do not use abbreviation or Latin terms. Like, you can accept for the standard, like you can use mg for milligram and ml for milliliter, but do not use abbreviation for microgram, nanogram, international units. Okay, so avoid using decimal points if possible, but if write quantities less than 1 gram, or like do not put 0.1 gram or point something. Just try writing less than 1 gram as milligram or something. Okay, so if using a decimal point, always try to put a zero before that, so it would be more highlighted. And limit the number of item on a prescription to 3. When you are prescribing other drug, you can, on a one prescription, you can prescribe 3 drugs. But if the drug is under the Schedule 8, which means that the drug has the potential to make the patient can become abusive of those drugs, then you should only prescribe one medication. Use computer generated prescriptions if possible. If space is unused on the prescription, put a line across, and dentist may not order repeat prescription. The prescription and the patient. When prescribing a drug, provide the patient with specific information about the drug, including, like, what you will also write it on the prescription, but you will also tell all this information to him as well, to explain him the generic or approved name of the drug, the expected effects of the drug, and what it is used for. Like, for example, if you are prescribing ibuprofen, you should tell the patient, okay, so I'm prescribing this medication to you, and what why you are prescribing, because you are in pain, so that's the reason I'm prescribing. What effects it can cause to your body, like it can give you some nausea, and most importantly, try avoid taking alcohol with ibuprofen, because that can lead to some tummy issues. And you also need to give the instructions, like which dose, including the dose, how much you need to take the medicine, and through which route, and until what, how many days, and what is the frequency. Okay, then potential adverse effects also you need to tell the patient, and what to do if they occur. Like if there is any allergic reaction to any medicine, or any other problem, then what they need to do, you should inform the patient. And other precautions, like any interactions, like if the patient is taking warfarin, you should not prescribe him metronidazole or some other medicines or some other antibiotics, which can, they do some interactions and can impair the blood thinner level in the body. So whenever you're prescribing anything to the patient, you should be 100% sure that, and you should be explaining everything to the patient, what this drug is gonna do, and how it would work. When to return for review, and permission to contact you if necessary. Patients often do not remember the verbal instructions, so it is always a good idea to give them written instructions as well. So this is the example that they have given for us. You can follow this prescription pattern. All right, so our next chapter is about the antimicrobials. You all know that, antimicrobial is very, very important topic for this exam, and they do not want you to prescribe antibiotic just without knowing. Like you should be so particular when you need to prescribe and when you not. Okay. So, practical information on using drugs in dentistry, principles of antimicrobial use in dental practice, appropriate antimicrobial prescribing in dental practice. This topic outlines the principles of appropriate antimicrobial use in dentistry. Appropriate antimicrobial therapy improves, like if you will prescribe the patient appropriately, it will help in making improving the patient outcome. It will reduce the unnecessary effects and reduce the adverse consequences for the patient and for the community, because antibiotic can cause the resistance, and which is a community based problem. Appropriate antimicrobial prescribing. What does this mean? It means that decide whether antimicrobial therapy is indicated. The majority of the infection that present in dental practice require only dental treatment to address. Like if the patient only has the localized infection, okay, then you should not be prescribing him the antibiotic, because the best thing that they have told us in the previous pages is best thing to help with any dental infection or any dental pain is the active dental treatment. Antibiotic therapy may also be required but is not a substitute for dental treatment. Select an antimicrobial for the indication that is consistent with appropriate clinical guideline recommendations or based on advice from an infectious disease physicians or clinical microbiologist. Consider patient factor. Like, first of all, decide whether you really need to prescribe the antibiotic to the patient or not. Then you think like there is a need to prescribe, then you need to take these things. First of all, you need to check with the patient if the patient is allergic to any antibiotic. Then you need to check if he has taken any recent antibiotic, and pregnancy and breastfeeding status. Okay, and when you're prescribing it, write down in your notes as well that you have prescribed this antibiotic to the patient. In medical records or medication chart, including the indication and the intended duration of therapy. The antimicrobial regimes recommended in these guidelines are chosen with respect to the optimal route of administration and duration of therapy and antimicrobial stewardship principles. So they have made these guidelines, and we will discuss it in more detail, like what they actually meant to say here. Okay, so here are 15 pages. It's done. So I'll see you in the next video, and I would really appreciate if you can, put down in the comment box or on the Facebook or somewhere, if you can let me know that these videos are really helping you. And if you want me to like make a specific video and on any other topic or any other thing, all right, so that's all, and thank you so much for watching my video, and you can always like, share and subscribe. Thank you.